So at this point, I have my panelists that are here today. You can come on, please. Let me see you so I can. There you go. I think I'll make sure all the faces are there so I can catch everyone. And we're going to have a panel discussion. I'm glad to. I'll go down my list, and they can probably wave their hands. I have Miss Angelina Brown, who's with the Can Serve Vive ministry at Trinity United Church of Christ in Chicago, with Reverend Dr. Otis Moss that you heard. I have Reverend George Hardy, who is the coordinator. I see he needs to put his camera on there, Reverend Hardy, but he's the coordinator for the 11th Episcopal District Sons of Allen with the AME Church. He's in a conference. Thank you so much for being here. Brother Keith Parker, a dynamite fellow from Ebenezer AME. You heard his pastor, the Reverend Dr. Granger Browning, start us off in that discussion. He's involved with the men's ministry. Mr. Craig Hymon, our Minister Hymon, man, dynamic man with the men's ministry at Reid Temple AME Church with Dr. Whitlock, who is there. AME, we are so happy to have him. Then my dear brother, Mr. Clinton Burnside. Where you at? There he is. He's the Senior Outreach Coordinator for Men Take 10 with Howard University Cancer Center in Washington, D.C. We're happy about that. Deacon Maurice Blane. I see him. I know he's there. There he is. He's with the Alfred Street Baptist Church, and we're so glad to have him with all that they're doing there, as you heard his pastor as well. And I have Reverend Newberry, you there? There he is. He kicked us off from Enon Tabernacle. And I have Reverend Patrick O'Connor, senior pastor of the Presbyterian Church of Jamaica in New York. Am I missing anyone? Did I miss anyone? Somebody can, I'm sorry. I think I have everybody on. Okay, then I think we can get started. I better take a look at my time to make sure we're doing. Let me, Ms. Brown, you're there. I'm sure you're there. Let's start with you. I want to ask this question that I have for us. Do you see a sense of awareness about the seriousness of the prostate cancer crisis within your community? Are you seeing that? And then what are the primary needs that you think that might help to, eliminate this crisis within the community? And there might be barriers or other things. Give us your comment on what you're doing with your ministry. I know you've had a very powerful piece that you all did this past spring, and we certainly, Ms. Miller and I were there last year at your church, and a great rally was going on in Illinois. Share that with our attendees today, guests, and I want all of the other panelists to keep that in mind. Those would be some of my primary questions. But let me start off with you, Ms. Brown. It's so good to see you today. Thank you for being with us.
Thank you for inviting me. I really appreciate it. It's nice to be here. After Ben came to Trinity last year, because it had been 8 years since we had not done anything on a regular basis, I got with the men's ministry at Trinity, and we decided to do something in June during Men's Health Month. It's June. So we worked with some outside sources, a prostate foundation. We got in touch with Dr. Adam Murphy, who's a urologist and a member of FIN at Northwestern, and a few other resources. And we held a men's health event, awareness event at Trinity, with the focus being on prostate cancer. Dr. Murphy was gracious enough to set up free PSA blood screenings at church, just asking for 25 men to participate. We had 29. And I thought that was interesting because Reverend Moss was not at church that Sunday. And we did have an announcement made from the pulpit that the men came back. So we did 29 men came back and actually did the blood draw and the screening. We had some businesses on from the south side of Chicago because the emphasis when you all were there in June of last year or July of last year was the emphasis was on the south side of Chicago
Okay.
because the numbers had increased more and more. And the only way that it was going to be contained or get the word out, the churches on the south side of Chicago had to become involved with the community and start with the men in the church.
Mm,
We realize that we do a lot of things at Trinity that for children, women, and other things, but sometimes there's not an emphasis on men's health issues.
mm,
So it was a success for the mere fact that we had an open discussion after the
mm,
awareness event with Dr. Murphy and Dr. Johnson headed up the discussion on prostate cancer and other chronic illness
mm,
that affects Black men in our community. So now the emphasis is to do it on a yearly basis, at least twice a year, and to be involved with some of the businesses and some of the organizations on the south side of Chicago and
mm.
form a collaboration with them to get the word out in our community. Um, I was invited to be part of a discussion for the South Side of Chicago with I think it's Pfizer and Estella,
Mhm.
and the emphasis is to get the word out, but also to make the information that gets out not so technical, but in layman's terms.
Mhm.
So
Mhm.
men and women and everybody will understand the importance of prostate cancer and the awareness that there are two ways to do this, through blood screening and then the traditional way.
Okay.
So we're going to move forward with this at the church and to do more with other organizations on the south side of Chicago.
Phenomenal. Would you say that you? It sounds like you're making a difference. Would you feel that you're making a difference in that community with what you're doing? I know when we came, also Congressman Jackson spoke. Did a very important piece there in making the message when we were there in the community. So you have community leaders quite involved there. So you feel, I'm pretty sure, that this whole partnership and the work you're doing is making a difference, particularly in the south side of Chicago. Is that correct?
Yes, I do. And we're this year, we're planning to move forward in 2026 to bring Congressman Jackson back and get him involved and get involved with some of the prostate foundations that are very active on the south side of Chicago. Because the emphasis is we need to start in our own community. We need to make the men feel that they are important and that their health is an issue and that this is not a stigma. This is touch one, save one.
Okay, great. I think the good thing that I like is that there's a movement. When we had that session at your church, I learned something about Chicago men that I didn't know, and I didn't know
But
whether it was Steve Harvey who. But right after we had that session, the men got together
in a
and they came and
circle.
started talking to us about stepping. Now I didn't know what a
Mm-hmm.
stepping was. I know about some fraternities and all of that, but they were telling us that look, where we need to move this thing now is to the steppers because they
Yes.
have mentioned that there are 20,000 steppers or whatever that come.
Mm-hmm.
I want to fly back to see that. I'll bring the fin stuff. Are they still talking that strategy? Come on, y'all.
Yeah, they are with the men's ministry. So um, there's there's a lot of organizations. There's a lot of grassroots organizations on the south side of Chicago, but it has to start when you were talking about they formed a circle back there after the discussion, and it was
Mm-hmm.
like 75 men, and
Mm-hmm.
they were all talking about their journey and how this can move forward and how we need to go out and touch one save one, and members, the men should know their numbers.
Yes.
So we're moving in the right direction.
Yes.
It's not going to happen overnight, but at least the ministries have not taken their eye off the cause.
Well, I think that's wonderful. Reverend Hardy, are you there? Because I know you're going to have to step off. Can I jump over to you real quick? Thank you very much, Ms. Brown. I'm
You're
I'm looking
welcome.
forward to stepping. I don't know what I got to do as long as I don't trip over myself, but
All
I'm
right.
trying to do. Hey, Reverend Hardy, I know you're in your conference with your bishop, but let's real quick the same question to you. What needs do you see? And is this awareness? Is it serious? Do you find it? We've come to your Sons of Allen retreats for the last 2 or 3 years with 300 men or more there from all of your district and 11 Episcopal district for the AME Church. And you, Reverend Hardy, I remember last year brought us over 100 churches to sign up in our Fin portal and Fin Church piece so they can have access to this. And that's the whole point of us working with the denominational churches. Talk to me a little bit about what you're seeing and tell me whether it's serious. And I don't know whether you got stepping down there in Florida, but once I learn something in Chicago, I might be the lead down there in Florida. So help me out.
I believe that stepping was birthed in Florida.
Oh,
Chicago saw it, and they're doing a great job of moving it to another level. But we have been blessed in the state of Florida and also the Commonwealth of the Bahamas by Finn's movement, providing awareness with the brethren. We were blessed to be able to have what we call an annual retreat that takes place in Florida, where we're able to bring at least 350 to 400 men together in one spot over the entire state. And then you all have blessed us to be able to provide the blood testing. From those tests, men have been showing up positive, and they have been open in your other programs, your other movements, sharing their information with other brothers. And that's those testimonies and witnesses I think is what makes us stronger, because the brother has been, he didn't keep it quiet. A lot of time men, we're kind of touchy about medical movements anyway, whether it's prostate or whether it's blood pressure or anything else. We're kind of in the closet. But I believe that watching Finn move with this prostate movement, not so much that some of our major leaders, like our president of the United States, right, used to be presidents, have come up, along with some of our movie stars and some of our sports analysts have shown up with prostate cancer. But with the movement that Finn has brought to state of Florida and so many other places has been admirable, where men have been taught, been brought to the place where, listen, bro, you're in a place now where you can't even wear white clothes anymore because you don't want stained clothes in your area. You got to watch how you dress and watch how you show up because of your prostate showing you there's an issue there. So we're just so glad that we were able to join your movement, to become partners with Finn, to be able to share this movement. And the awareness movement is real, that we're able to get the word out. Yes, we have 100 churches in Florida that are part of this movement now, but our goal is that all 420 churches are able to be a part of this movement. Lives are being changed, communities are being empowered, the word is being shared, and especially again, it's this month of September, Men's Month and Men's Day in June. You all provided us with information that we can share with the brothers and the churches through your portal. We don't have to design anything or make up anything. Finn's giving out enough information for us to plug into it and to move it forward. Lives are being saved and folks are being empowered. We thank God for what you all bring. We just got to latch on to it with a stronger heart. What I'm asking for now is for more of the pastors as leaders of the churches and their communities to lift their voices so that others may become a part of this awesome movement. I thank God for what's taking place. I know it's going to get better around the corner. Lives are being changed and saved. In Jesus' name, we give thanks to your ministry, your movement. Adrian, you've been with me. You didn't start texting me in the morning. Have a great day. I'm saying, who's he text? But what? But that's how this movement works. We're becoming a larger family. We're making changes, not only in Florida, but I see this across the nation. Even in Jamaica, a senator called me up and he wants to go to Jamaica He's already gotten the plane tickets ready. He's already gotten the hotel set up for us to have a major movement in the Bahamas as well as Jamaica. So we're excited with this movement.
All right. Thank you very much. It sounds like things are jumping off like the fish now. Y'all got it going. Hey, Minister Hymon, what's happening over there at Reid Temple? Tell me, I know some of you are in locations, have been traveling. Some of you have to get back to conference. So I'm just kind of calling through. Tell me where you are in at Reid Temple, sir. We had a great time there, been long-term partners. And then also tell us some of the, now Reverend Harder, he'll tell it all because he already told me. And one of the questions I have is that in what way can Finn do more? And so he's already sounding like but I'm going to ask you, tell me what's going on and what you think, Minister Hymon, and I'm very happy that you are able to be with us, sir.
Thank you, Dr. Backus. I appreciate the invite and bring you greetings on behalf of my pastor, Reverend Dr. Mark E. Willock Jr., and the entire Reid Temple family. We are family with Finn. I can tell you, you all have an outstanding program that you have consistently showed up and have helped us time and time again. I personally know over the last 6 to 7 years, 15 to 18 men's lives that you have saved, that you have changed, that you have helped through being able to get this information out. And we are so excited because we know that, it's more coming. The best is yet to come with this because we're able to open up the conversation now. That is probably the toughest part about all of this. Just like the gentleman was just speaking and saying, it's about the information getting out and then being able to have that tough conversation. We as men can be tough. We don't always want to talk about the doctors. We don't want to have any tough conversations, but this is where accountability comes in. Find somebody that you'll listen to. If you won't listen to anybody, we all got at least one person as a man that we'll listen to. It might be a wife, might be a girlfriend, might be the pastor, might be a best friend, but somebody so that we can go ahead and continue to do what we're doing with this work. I think Finn is phenomenal with what you all have provided for us. The screening part of what you have done to be able to come out and say, hey, Craig, they don't even need insurance. Just show up. When you came out to us, I believe we had about 40 some people that ended up getting screening that day when you came out with Howard University and when you were there with the Alphas. And in addition to that, I believe it was 30 plus men that got high blood pressure screening, another thing that plagues us in our communities. So we are definitely grateful for that. And with your screening, you allow them to now go into finding treatment. They get that treatment. They can go ahead and start looking at it and not have to worry about whether or not I got somewhere to go because you've given them the resources. You give them the support. You give them the time. I personally know somebody a couple of weeks ago that talked to one of y'all about their prostate issue that they're going through right now as we speak. So your work is definitely global. We are grateful for you. The support that you're giving that we would not have without Finn is unmatched. I can't explain and express that enough. We don't have anywhere else that we would get this level of love, this level of support, this level of making sure that we are getting everything that we need because you all have really and truly elevated what you've done to a place where I'm listening. And like the gentleman said, it's all the way in the Bahamas, right? But this thing is everywhere. And it needs to be because if cancer thinks that it's going to go everywhere and Finn is not there, it needs to be on notice that Finn's going to show up when it shows up. So we are, again, we're thankful. And what we can do as the churches is continue to advocate for Finn, continue to advocate for the brothers to come together. And we utilize this by going out into the community and partnering up with places we know the men are going to be. They're going to be at the barbershop. That's one of the places that is like an icon for us. So we start with places like the barbershop and give them information. Like, and I never really had this conversation with you, Dr. Backus, but if you have information, we partner with them, then we get more information from you to pass out to them. And you don't always have to do that personally, where we will be the conduit for that and get that to those groups, get those to the fraternities, get inside of some of the schools. And as we do that, we will continue to expand and be able to let people see that you can live when you have prostate cancer. You just have to be bold enough, strong enough, have enough support behind you, have people that are in your corner rooting you on to cheer you to the finish line, because I've seen it time and time again with these brothers. And these the same brothers now that are, we just had a men's prayer breakfast at one of the at Reverend Richardson's house, Reverend Bobby Richardson, one of the cancer survivors that Finn helped. And we had a bunch of men that were there that showed up. And as I'm looking, I saw several prostate cancer survivors at that meeting that you all helped. So again, we are grateful and thank you. You know, anything you need from Reid Temple, I can definitely tell you that Pastor Mark and the Reid Temple family is here to support you in any way we can.
Thank you, thank you, thank you. I tell you, I'm hearing a testimony, I'm hearing a witness, I'm hearing truth. And I got to throw his name out there, both of them. That's Reverend Artie, Dr. Artie, I call him, Shelton, and also our other Dr. Smith, James Smith. They've been roaming me. Yeah, there's our Finn ambassadors, and those are great friends of where we are. So thank you for that witness. But since you mentioned Howard, how about you over there, Mr. Clinton Burnside? We were running together every weekend. I don't know if your wife was going to throw you out or mine would throw me out, but talk about it a little bit about what's happening with the Howard Center. That's been a fabulous partnership. We did a lot of work in the DMV this past June for all the churches and what's happening, major promotion campaign. And Howard was with us, the head of the urology department, the president of the hospital. And that's important. This is about faith and partnership. You can hear my ministers out there. They are not going to hold back. So I want to talk to you now about you. You've had that ride. Tell us what's going on. We hope we've enhanced, and how can we better do a partnership with organizations like Howard, and we have others, PCEC and others who have supported our endeavors, especially with the screening. But you're on the streets from DC, and y'all did a commitment to extend that bus, not just to Washington, but you roamed around in the outskirts too of Maryland and were willing to go to Virginia. It's that commitment and willingness that we need in terms of partnering to save lives. Talk about it. I'll hush my mouth.
Well, thank you so much for this opportunity, Reverend Backus, and certainly and the Finn family, because certainly the partnership with us here at Howard University has been phenomenal. I mean, it really speaks to the true testament of working together. We're better together, you know, because, you know, there's only so much that we can do as individual groups, but when we come together, we can certainly expand the work that we do. And I think one of the primary needs in terms of, you know, eliminating prostate cancer is really education. And so I want to take it a step further and not just say it's the education piece, but tailored education, so that like you mentioned, the different events that we attended, we had to make small tweaks to every location that we went. And I think that's key, because every individual that we talk to, there's going to be a different situation or scenario that they're going to be facing. So we have to keep that in mind as we kind of address these issues. And certainly, you know, like as you just mentioned, one of the major barriers is really access to care. And so that's where we certainly play a huge role with having our mobile unit, and being able to I think it's 803 South said, boots on the ground. That's what's really, really important. Not just sitting in the offices and saying, oh, well, we think this will work, we think that'll work, but actually going out into the community and being a part of it, and allowing the community to have their input in terms of what we kind of create to eliminate the barriers. And so we're just excited to continue to partner, because we've been working with Finn for well over 15 years now, probably much longer than that, but at least since I've been here at Howard. And we're certainly continuing to grow and making new partners as we move forward. I mean, because that's truly what's needed. Because we can't do these efforts alone. You know, we're much better together. And so in terms of kind of the next steps for it is really to continue to do what we're doing, but take it to the next level. So I know like with the events that we've partnered with thus far, our focus has really been on prostate cancer. But I really want you to just kind of think about, if we have this captive audience of so many men, and I know the focus is prostate cancer, but what if we started talking about some other health conditions like heart disease, the #1 killer of men in the United States? What if we kind of make that more of a global thing, you know, in terms of kind of what we do? So in terms of the next step for us, And what we're inviting Finn to certainly be a part of is when we go to these events, make it more than just prostate focus. Let's do a men's health overall focus to kind of capture all things that men are dealing with. But we don't want to exclude the prostate, because that's certainly important, because that's one of the main killers of men in our area, certainly. But we certainly have to do it together. And so I certainly welcome more and more opportunities to work with Finn, as well as other groups on this call that are interested and just being boots on the ground. We can no longer sit back in our offices or in our towers and say, hey, this is what needs to happen. We have to be out on the grounds and doing it.
Yeah, well, now see, you have just moved to the preacher level, because you just gave the witness, brother, and I'm really happy. But what you're saying is right. We did have a strong relationship, and we learned a lot. We came into health fairs. We came into different types of very creative environments, so that we could see how we would work together. I think that's the key of what you're saying. I think I heard that from Craig too. Is that how do we find these, as they say, faith and partnerships? How do we find these partnerships that are on the ground? Now, there's something that you mentioned about other, when you do screening or different things that you might be able to enhance your program in some way. Reverend Newberry, I want you to think about that, because you're doing that at Enon. Some of the things that he's talking about that they might want to look at with Hartman. But I want to jump up over to New York right now. Can I come in Jamaica over there in New York? This gentleman here, Reverend O'Connor, you have quite a program going over there, and you were part of our New York, New Jersey program, and with Pfizer. And from back then, you've been running, but you've been doing this for over 20 years. I think we had a 20-year anniversary this year. But what I did learn too is I looked you up a little more. You got quite an establishment over there. Let me say that. The hospital connection, you have a whole turnkey piece at your church and what you're involved with in ministry, but there's a key focus that you have also in prostate cancer. So let me hear from you, Reverend O'Connor, because you're doing some marvelous work, and you got some real serious numbers that you certainly have been screening over the years.
Thank you, and thanks to FEN for their partnership, and to you, Reverend Bacchus, for just the passion and energy you bring to this work. When I was 40, I got prostate cancer, and the doctor at Weill Cornell who did the surgery, I challenged him that if he helped me, could he come and help some other men? Well, when he came to Jamaica the first year, and it was a shoestring operation, 300 men showed up for the screening. It blew our mind. And the partnership was with Weill Cornell. The women in the congregation seen their pastor going through prostate cancer, said, we'll help you. So they cooked food, provided a breakfast and lunch for the men, and then they did the blood drawing, those who were medical professionals. And from that initial 300 man screening, consistently our numbers have been between 170 and 250. And a big part of it has been going door to door, barbershops in our neighborhood, having a team of both men and women make phone calls to people who came previously, as well as men who are part of their journey. Our partners made the investment, and initially, when we had no sponsors, helped to raise the money so that we could do the testing. The doctor who did the surgery for me came with a team of 7 urologists who he was training, and it became part of their training. And we're grateful now that we have expanded from just prostate cancer screening, which is still the heart of the event, to a full service health fair in which men get support around diabetes, heart disease, eye testing, hearing testing, nutrition. The prostate screening led to a partnership with our community healthcare network, which is our federally qualified health center in a building next door to us that we created. And the collaboration says that it's not just one church trying to address this, but a church that has organized relationships with hospitals, with doctors, with other healthcare practitioners to say Black men matter. So that it's really evolved, and at the heart of it, because this was personal to me, I got involved and made sure whatever connections could be made, we made it so that we could save men's lives.
It's a phenomenal witness for sure of what's been going on, and we certainly have been happy to provide educational materials and all the things. But the journey that you've had, certainly, in what you're doing to save lives in the area is key. And plus, I think we saw on the tape, we got representative from the leaders. Like I said, in your area, you are in the district of your Congressman Meeks.
Gregory
Who's
Meeks.
been with us for a long time, and different ones who are speaking today. Their pastors were the ones that we heard. As I say, that passion starts at the top, and now we're seeing how it's worked out at the bottom. But the bottom is the top if you understand how things work, because they work together. And so I'm just really thankful for what your witness have been. And hey, Mr. Parker, I got to talk to Mr. Keith Parker. What's happening over there at Ebenezer, sir? You had quite a program out there that we went to. We were running all over the place over there, but talk to us and tell us what's happening. I know your interest also has been about younger men. I think we heard Reverend Broderick talk about that when he was saying something to Mr. Farrington when they were talking, and somebody said, "Oh, a person 72." He kind of talks about that in our tape, as you saw, and said we're going to have it this many. I thought that was very critical. We are looking at that. Talk to me about that, because yours is the engagement, like we're seeing in some other churches, like his Kingdom and others, where they're looking at what's the voice and how do you get to these younger men. And I want Reverend O'Connor, some of you who have been in this, Blane, you might have some ideas too about the engagement of the younger men. We're talking 40 on up, but you might think about it. But talk to me, Mr. Parker, as you're developing a very extremely great ministry out at Ebenezer AME.
Thank you there, Reverend Bacchus. Greetings, everyone. My name is Keith Parkin on behalf of Dr. Granger Browning, our co-pastor, our senior pastor, and our co-pastor, Joanne Browning of Ebenezer AME. We bring you blessings today as we talk about this forum. And so at Ebenezer, the journey kind of started from a personal journey. Myself being diagnosed with prostate cancer in 2023. And one of the challenges that I would say was the standard of care that I had to endure during my journey. Just from the biopsy, whatever happened, I was barely able to get out of the bed for 8 weeks, 2 months. I was barely able to get out the bed. And from that, I took on a mission of focusing on the mind, body, and spirit. And from that mind, body, and spirit, initially came to the men's season. I went to our first men's season at Ebenezer and totally got into the spirit and began to speak to men about what my challenges were, because I was just getting the ability to be able to walk again. And you know, when it comes to men, it comes to prostate and that fear, men didn't want to talk. And so that took us into the HLJ prayer line, which we meet every morning at 6 a.m. sharp and 5:30 on Saturdays for in-depth Bible study. And I began to pray in the spirit and speak during these prayer calls every morning. And it created a interest where men were able to want to talk. And so 1 year ago, where we really started our journey at Ebenezer AME, and it was a daily prayer call during prostate Cancer Awareness Month in September. And that led into us having a for men only session where men showed up, and that's all we talked about was prostate cancer. And then what was real phenomenal during my journey is, in addition to Reverend Backus, was Dr. Keith Crawford, because going through that standard of care, where I got to the point that I couldn't, we weren't receiving the care we were looking for. And Dr. Keith Crawford spent a couple of hours one evening and just talking me through the thought process, talking me through the emotion, talking me through the detection process and what happens afterwards. And I took that information from Dr. Crawford, processed that, and started putting that in prayer. And we started ministering to men at Ebenezer. And so what came out of that, last year, 2024, our men's season, we had over 300 men at the National Conference Center. And when we had the Reverend Backus was there, Dr. Crawford was there, and the esteemed physicians that came from around the country. And we had over 6 microphones, and each line had 7 to 8 people deep. And the 90 minutes that we had for prostate awareness was nowhere near enough. Dr. Backus and Dr. Crawford and the physicians couldn't even get out the room. The men were pulling them back. And so from there, we began speaking to the young people because I was the young one at the time in my 50s, and I was considered young and understanding that prostate cancer needs to be looked at a much younger age. And so we began these series of discussions last June during the DMV rally. It was so phenomenal working with the Howard University Men Take 10 and working with Reverend Backus. And we had over 64% of the men that came actually went through prostate awareness screening during that time. And it would have been higher. That's when we found out that some of the men, when you're above 75 years old, you can't get screened. But beside that, over 64% of the men that attended. And so the awareness is what we really focused on in the beginning. Now our focus now is getting into the education, because now we have men that are standing up now. We have men that are wearing their blue ribbons now coming to church. We have men that are now calling each other and asking about, hey, I've got diagnosed. I got another person being diagnosed. And right now we're starting to build up a team of men at Ebenezer in the men's ministry, right? Such that if you have a question, if you have a concern, here's someone to call. And now we're about to redirect traffic going to the Fin network and building a relationship with our health ministry at church. Because I will tell you, at Ebenezer, we have a great health ministry, but when it came to the men, they probably didn't have quite as much emphasis over the years. But because of FIN, because of prostate cancer, because of the awareness, we're now working on building the education phase because the men are asking for it. And not only the men asking for it, but the young men are now becoming aware. And we're letting them know, even though you're 35, you're 40 years old, you need to know what your number is. Do not allow to go in annually for your comprehensive exam and not know where your number is so that we can set a trend. And so education is what we're trying to build now. And as well, when you talk about prostate cancer, it's just not about prostate cancer, it's all those things that lead into it. Because those that are diagnosed, we notice there's diabetes, high blood pressure, there's these other mitigating health conditions that are common amongst folks that are diagnosed with prostate cancer. So now we're about to elevate a little bit more, and we're starting to think about how to do a more holistic program of men. But what I will tell you is, from the Prostate Health Education Network, it has been a blessing not only to me, but it's been a blessing to the church. And right now, it's almost difficult because so many calls and so much emphasis and so many emails are coming in that we can't even keep up with it no more. And we're working with our leaders of the health ministry to strengthen and embolden the partnership with Prostate Health Education Network, such that now we can direct people to a portal such that you can know how to detect, you know how to survivorship, and you can understand those clinical trials that you may be eligible for. So, thank you for all that we've brought, Reverend Bacchus. It's been instrumental. And at Ebenezer, we've only just started, and the best is yet to come.
All right, you hear another preacher in the hand up here in the house. Let me see where I'm going. Hey, Deacon Blane, how are you? I'm telling you, I know you got fired because we had Reverend Howard John Wesley. Y'all heard him call it out when he said what happened to him personally, and he said, "Don't let it be a curse to you." We have run I tell you, his message, like so many others, have been so powerful across the nation, and we know that you have, and a part of your cancer, you have that cancer care ministry as well, and we are so glad to have you today, Deacon Blane. And I think our question is certainly where you have a leader who's experiencing and certainly pours it into his sermons. What primary needs do you see, and tell us how serious is this situation within your community and church as you see it? But thank you for being here today as well.
Well, thank you for the opportunity, Reverend Bacchus. I'll just start. You started off where I lead the cancer awareness ministry for Alpha Street Baptist Church. Our mission is very simple. We create a spiritually uplifting community that empowers members with knowledge, resource, and emotional support. And so I will just echo a lot of the things I've already heard. So number one is that spiritual connection that we first of all try to start off with our members, meeting them at that point. And then the next thing I think is really the transparency that we try to share inside of that space. I am a prostate cancer survivor, and what I talk is real talk. For people who come to talk to me, I give them the whole gamut of what I went through and my journey on the other side of this. So it's important for us to do that portion as well. And so Finn is just a part of when I look at the holistic ability to talk to people about this. Is Finn has enormous resources to be able to do that. But as I saw also when I went to Reid Temple's men's program, what you also need to be able to talk about is the environmental stresses that men are going through and why cancer is so prominent in that area. So now we're starting to get you a little bit more on the educational standpoint there. I had a young man at our event on Saturday, which was a holistic healthcare, and prostate cancer was a part of that discussion. But it was about, okay, you might be 23 years old, but what's your family history inside of that area? Do you understand your family history? So now that tells you when do you move away or move toward asking someone to do a PSH testing again with you and just not a rectal examination inside of that space there. And so then we start walking them through what are the medical pieces that you can actually look at and walk through. But then it's also, I believe, the continuous touching pieces there. After someone has gone through prostate cancer treatment, surgery, or whatever else, how are we continually talking with them? How are we continuously praying with them when we need to? And I tell people a lot of times as a cancer awareness ministry, I probably laugh more with people than I pray with them at times because they need someone to be able to talk with them and help them through life and everything else that they're going through. So again, I see Finn as just an important piece of, hey, when we need resources, when we had June Healthcare Month, Men's Month, where do we go to a resource that we can go and leverage and have them come with a professional outlook and have a great discussion with men? Yeah. And I believe you have to have this discussion with women as well. Yeah. I've been leading this journey for a long time. And one of the things I used to say at work is one of my friends at work would say, either someone with a prostate or you in love with someone with a prostate. And so bringing women inside of that space and helping them be a influencer for the men that are inside of that space and helping them and making sure that they are being tested is important. On my Facebook page right now, you'll see a picture of me with my blue ribbon and things like that. And people know on the background is Prostate Cancer Awareness Month. And I had a young lady, a lady who's a white lady who worked for me, who reached out to me and said, my husband gets tested because of your story. Oh, wow. And so what we tell people is this, as you going through this, you need to figure out what your testimony is.
Yes.
as
Yes.
you're going to talk about what you came through on the other side of that. And
Yes.
again, Finn is very important to us. I think the screening piece that you can bring to the forefront has to be a part of everything that we do. But it's also the education piece, partnering with professors from Howard. Wow, we get a really good discussion about genetics and how that all factors into that. And also, again, I go back to the environmental stressors that men are just under within that. And then the final piece I would say is, it just becomes a part of the conversation. But there's diabetes that we need to make sure that we're talking about. There's heart conditions that we need to be able to talk about. And so using that as a foundational piece from there, we can grow into much, much better and more conversations with men across the board and with women and with kids.
All right. Hey, again, I got these testimonies are hot out here. Reverend Newberry. All right, it's always got something. We don't have a plate that we're handing around, but you know how to bring it on home to me. You've heard a lot here today. We certainly been at Enon. Some of the strategies and discussions and needs that have been discussed, you've certainly experienced there, like so many of these other churches have. Can you kind of fill us in as well in terms of what you see that might be primary needs in terms of prostate cancer, the crisis within our community, and what's your sense of awareness? How serious is it happening in your community? And then what can Finn do in partnership with you? And I'm gonna ask the others too when we get closer to the end here. What else can we do to help you? But Reverend Newberry, let me hear your voice there, my friend.
Sure. Well, certainly, again, brothers and our sister Brown, thank you all. Everything you said, I agree 2000% with. We're doing it. We do from the perspective of what we do. It is indeed holistic ministry. There was a time when we really put our feet into and our grit into prostate cancer. But what we found is that our men and women are suffering from a plethora of major illnesses that are literally taking us out of here much younger than we should be. So under the leadership of Pastor Waller and our brother, another co-pastor with me, Reverend Leroy Miles, who is what we call our medical director, we set up a Saturday from 8 a.m. to about 8 to 9 p.m. And Finn has been with us on each of our events each year around April, and we call it a man cave. So what we do, we bring all the medical entities into us, doctors, nurses, specialists, researchers, you name it. We will bring them in. The highest testing amount that we have had of prostate cancer for the PSAs has been 1,000 men. That's Black and brown men. That's also Hispanic brothers and so forth. We also bring in community advocates as well who grace the day with us. Our nurses partner with us, but we're ministry based. So we do a lot through the ministry. And I'm sure you all know, because of the churches and pastors you represent, that everybody that we need sits in the pews of our churches. All we have to do is go and get them, bring the message, pull them out, and let's start talking. Because what happens is the web spreads. Once you get one or two or more of these professionals, they work for somebody or they work for themselves, and that develops sponsorships and so forth. And we're grateful for all the sponsorships that E9 gets along the way as well. We have indeed spread our ways into tailgate parties at the Eagles game. No offense to any Commanders fans or Patriots fans or anybody like that. We are the Super Bowl winner, but we also do we do swimming events. We do the events with the Masons, with the Muslim community. We do events also with all the fraternities as well. So we've spread our wings under that leadership of Pastor Waller. We do believe, and I'm glad Brother Hymon mentioned, we cannot do this without involving our wives and girlfriends and significant others who are involved. One of the brothers you saw who talked about his wife is one of the men in our support group. So we have a support group that meets monthly. We provide the counseling. individually and collectively. For the men, we do family counseling, family therapy, you name it, we're going to try to do it. Any medical areas, we're going to try to touch on everything that affects us, as a people. In addition to that, because part of my heritage is Barbados, I'm also involved. There is an Afro-Caribbean consortium of doctors, researchers, and specialists that deal specifically with Black and brown men from the Caribbean and African areas. And that's another important challenge for us as men within the confines of our own churches, because we who have Caribbean blood and African blood within us know that heart disease sits well above all of that. And then we need special testing like ATTRC testing to go along with even what we're doing with prostate cancer. So I appreciate what you all have brought to the table. Brother Burnside, we met several years back, and I appreciate the work that you all are doing at Howard University as well.
Well, I think I did my round robin, and I was getting so happy I almost forgot. I got to have question and answer. So there are people out here that I'm seeing putting various questions in the box. Tamika, I think you will be helping me. Let me say one question I saw was, where is everybody from? I think Ms. Brown is Chicago, Illinois. Reverend Hardy is down in Florida, Oakland Park. Mr. Parker, in terms of Ebenezer AME, is Fort Washington. Minister Hymon is in Glendale. That's the Reid Temple AME. Mr. Burnside certainly is in Washington, D.C. at Howard University. Reverend O'Connor is from Jamaica in New York. And Deacon Blane, I'm pretty sure that's Alexandria, Virginia. Is that correct? In terms of Reverend Howard John Wesley, I'm telling you. And then did I miss anybody? Okay, so Tamika, let you go through questions that our audience might have for some of you. And I have probably about a good 5 or 8 minutes left. And thank you all. I hope my questions were good. I think you all answered my questions. And so now I know I got a whole lot of places to go to find good friends for information and good support in all levels.
Sure.
So let me be quiet. And Ms. Miller, thank you so much.
Sure, Adrian. One of the questions that we have, how can we get the word out to the Divine Nine and Prince Hall Masonry to get the brothers at the grassroots level for awareness and early detection and remove the fear of testing?
Any one of you who are there, that's what the get the word out to the Divine Nine. I know you did something, Minister Hymon, I see you there because he worked with AFRS, and I see that Deacon Maurice Blane is there. So either one can get started and fill it out.
Yes, sir. We can definitely take this information, and this partnership with the Alphas has already been started. We did that last year with Finn and with Dr. Backus and Dr. Artie Shell. And for us, I believe that the push is there. You know how you have to plant the seed and then one comes and waters and the increase comes? You have to do that consistently, where we know that a lot of the times it's harder to break into a circle that you're not familiar or a part of. So the goal is find somebody that's in that organization. We have someone that was an alpha. That's the reason why we were able to bring the alphas in. And that is the strategy that I would say would be really good in order for you to be able to do that with the entire Divine Nine. And I believe he spoke of the Masonic Temple as well. So I think that that's the approach. Find someone that's there. Give them that information, because they'll be your biggest advocate to go back and to advocate on your behalf for the organization in order for them to be able to buy in on what you're trying to offer.
Okay.
So,
Deacon Blane?
Yeah, as an alpha, and I've been leading this charge, at least from in my chapter, for quite a while. We just got through making a really effective a video where we had at least 5 brothers get up and talk about their journey through prostate cancer. And I know I've talked to my our general president about making this a part of our national projects that we would do as a fraternity. I believe that's the way to push through that, is to make sure we're pushing the National Panhellenic Council to bring all the Divine Nine into that space. I know most fraternities are speaking about prostate awareness during the month of September. I know there is a march on I think it's the 27th of October. I'm sorry, the 27th of September in the DC area that I know chapters are going to participate into that. So I think especially the fraternities realize how important this is for their own general body. Because I have not talked to a brother who, we talk to a lot of brothers who's been affected. And I think that same transparency is important for those men to be able to stand up and then push into this in our own community.
Okay, I think hey, Reverend Newberry and also Mr. Parker. I know when I came to those churches, there was some Omegas around too. I saw the coats on. We had that down in Charlotte. You guys want to say anything about this as well? And then let me say, I won't throw out the sororities because Dr. Artie Shelton is very involved with various health initiatives, because what I'm learning, even with the 100 Black men or whatever, there's a pillar. They talk about pillars, and one of the pillars is one of health. So you want to say anything, Reverend Newberry and Mr. Parker, add anything?
Yeah, just real quick. I mean, I'm a Q, but the Q doesn't make me. And you all know that we're all Black men. God doesn't say, well, because you're a Q or Alpha, Kappa, I'm not going to take you now. You're gone, whether you are or not. But the idea is all of these presidents, basilisks, whatever you want to call them, approach them. That's what I say. Approach them. They're like us. They're men like us. Approach them about it. And as the brother said, they're there. Sometimes all you have to do is ask one or two. They will get it. Ask the Prince Hall Masons, and those are the groups that I go and get. I'm involved with them because they have the numbers. They have the numbers. And what happens is I won't say what organization it was, and this is where they said, well, if my men are sick, then I can't keep up my due structure. I can't say on this platform what my response was, but at the end of the day, we have to change that narrative, because our men in these fraternities and our sisters in these sororities are extremely important to the whole infrastructure of what it means to be a Black and brown family in America, especially now.
Okay, Mr. Parker.
Yeah, amen. So when it comes to these organizations, one of the secret sauce that we leveraged was the women, because men, we don't talk, right? But those wives and those significant others do, right? And so as a part of the Divine Nine and other organizations, we reached out to the women to bring their husbands, and we just so happened to have some new chapters that were established down in Fort Washington, and so we turned it into the community service project. So the organizations, and the way I pitched it to them is, this is a way that they'll be able to present to their national publication on how their chapters can get some acknowledgement and some press on their community service. So it's about the delivery and what people can get from it. And so Reverend Backus, when you saw the brothers there in a purple and gold, we had Basilai there and all the members of different the chapters that were local. Yes, the men of Omega Psi Phi stood up because that became a big public service announcement that goes to our national oracle, and we presented that to again the Masons and everyone else. But a big key is get to the women and significant others, because they will put an elbow on the husbands and the significant others and say, hey, you need to be out here to get your screening. So never leave the women out, because they know how to reach the men better than we do.
All right. I think that's a good final word. It looks like my next panel is about ready to come in at 2:20. I'm over about 2 minutes, but I want to thank all of my visitors today. What a powerful, powerful session that we've had, and some great witnesses here. And we pray that there's some tremendous information that's been shared to help you. So thank you all. Stay with us and continue to partner with us. I love you all, and thank you so much for saying yes to be here today. God bless you all. Thank you so much. Keep up the great work. Thank you, thank you, thank you.